This video will cover Toxoplasma Lymphadenitis. Let's begin by anchoring ourselves. Notice this barrel of toxic waste here. This represents toxoplasma since toxic and toxoplasma sound alike. The fact that there's this green goop overflowing from it will remind us of lymphadenitis, since things that are lymphoid in nature are usually represented in green, right? This disease is caused by a protozoan parasite named Toxoplasma gondii. Relevant to us as pathologists is the fact that on biopsy, tachyzoites and bradyzoites may be seen. Tachyzoites are 3 to 5 micrometer curved structures that to me kind of look like a boomerang. They also have an eccentric nucleus. Tachyzoites are associated with acute infection. To represent these, we have this boomerang here. Let's move on. Bradyzoites are associated with chronic infection, and they are the intracellular replicative form of the organism. Multiple of these bradyzoites are contained within a spherical cyst in tissue such as brain, myocardium, skeletal muscle, and eyes, and this ranges from 5 to 50 micrometers. To represent these cysts with bradyzoites inside, just take a look at what's right under the boomerang. If you Google these, this is basically what they look like, and that's how we're going to remember them. Cats are the definitive host for this organism. This is simply represented by this cat here. Transmission can be through cat feces that contain oocyst. I didn't feel like including cat feces in this one, so let's just remember it with this cat. Another form of transmission is through undercooked meat of animals harboring tissue cysts. This one is obvious. We've got a nice raw piece of meat here to help us. The next form of transmission is via blood or organ transplantation. We'll remember these by noticing this blood drive here in the background. The last form of transmission is transplacentally, which of course is represented by this pregnant woman. The classic clinical feature of infection is a mononucleosis-like syndrome with posterior cervical lymphadenopathy. If you notice our character, she looks like she's got a common cold or something. She's also even got some cervical lymphadenopathy. These two will help us remember the mononucleosis-like syndrome. When toxoplasma is acquired during pregnancy during the first trimester, there is risk of fetal demise. I don't think this one is too difficult to remember since the first trimester is arguably the most important for the initial development of the fetus. If the infection is acquired in later stages of pregnancy, there is a risk of fetal CNS infection leading to periventricular calcifications and chorioretinitis. Our symbol for periventricular calcifications will be this ventriloquist here, since ventriloquist sounds like ventricular. Notice how he's manipulating these rocks. These rocks are purple and they represent calcifications because, well, that's what calcifications kind of look like on H&E. And since these rocks are right next to the ventriloquist, we'll remember periventricular. We've used the lab courier in the past to represent choriocarcinoma since courier sounds similar to chorio. In this scene, however, the courier will represent chorioretinitis. And to remember retinitis, well, we have these scary red eyes on this character. Okay, now to wrap things up, let's talk about two histological features seen in lymph nodes, since this video is titled Toxoplasma Lymphadenitis. The first one to talk about are loose clusters of epithelial and histiocytes encroaching on follicles. If you really notice this scene, it takes place in a vintage or historic place and time. This historic scene represents histiocytes, since histiocytes sound similar to historic. And these fall leaves here represent follicles, since fall sounds like follicle. Put these two together and we'll easily remember this feature of aggregates of histiocytes encroaching on follicles. Another important feature is the presence of monocytoid B cells in the sinuses. As in past videos, monocytoid is represented by the Monopoly character because Monopoly has mono in it just like monocytoid. And our character's hat even has the letter B on it to help us remember B cells. I'm not going to include a symbol for the fact that these are in the sinuses because we know that usually B cells are mostly concentrated in the cortex, so if this is an abnormal pattern we're talking about, we can easily then remember that they're in the other major space besides the cortex, which is the sinus.